Now today we talk about jaundice in children and what is the role of pediatric surgeon in such cases. Now jaundice is because of the accumulation of the bile into the blood. When this bile gets accumulated beyond certain level, it causes the yellowness of the skin and yellowness of the eyes. And that's how we diagnose that a child has got a jaundice. Now when child is born, normally on third or fourth day, most of the children they develop jaundice, and this jaundice disappears by the age of 14 or 15 days. Now as it disappears normally, we call this as a physiological jaundice. Now these cases are normally treated by the pediatricians, means medical doctors of the children. When the bilirubin level goes very high, or when child stops feeding, or child becomes irritable, or child looks sick, then these cases are admitted in the hospital and they are put under the phototherapy, the light of the tube lights, and this light converts the bilirubin into absorbable bilirubin and it is excreted into the urine and stool. Now, this jaundice suppose continues beyond the age of 1 month, invariably one has to diagnose some problem into the child, and this can be done with the help of ultrasonography or a HIDA scan. There are two conditions where surgeon is required to treat this baby. One commonest problem is biliary atresia. In biliary atresia, there are no bile ducts which comes out from the liver going to the intestine, and that's why bilirubin keeps on collecting into the blood and causes gradual damage to the liver, and the jaundice does not disappear. Now most of these biliary atresia children, they do not pass normal yellow color stool. They will be passing white color stool and the urine will be darkly yellow. Now this has to be confirmed with the help of ultrasonography and HIDA scan. Now both these investigations are not 100% confirmative whether child has got biliary atresia or infective hepatitis. So nowadays what we do is we do a laparoscopy, diagnostic laparoscopy. In this case we see the biliary tree, and if the gallbladder is seen, we inject the dye and we take the X-ray. If the dye goes into intestine, that means the child has got a normal biliary tree and does not require further surgery. In that case, we take the liver biopsy and we come out, and child is handed over to the medical doctors of the children. Now, if child has got no biliary tree, invariably child requires a major operation, and we make biliary duct from the intestine. That is known as Kasai's operation. This is a very major operation, and only 1/3 patient gets 100% cure with this operation, while 2/3 of the patients may require further treatment or even liver transplantation.